diaphragm will try to contract, or whenever you try to take the inspirations, this would not able to open up. Right, so the alveoli would not able to open up, right? So because of what happens with the positive pressure, what happens is that that's going to increase the what? The resistance, which means that it's going to increase the pulmonary vascular resistance, okay? And if that is happening, then what else is going to happen is that with the interstitium, what's going to happen is that your lungs are going to start what? Collapsing, okay? When the lungs are start collapsing, what happens is you're going to see, okay, you cannot take it, you cannot expand the lungs, okay, you decrease in compliant, let's say, you decrease in compliant, that means you cannot expand the lungs, which basically means that you're going to have a decrease in what? You're not able to take the air in. You're going to have a decrease in tidal volume, which is the amount of air that you take in and take out per minute. Then after that, if you decrease tidal volume, what happens? You're also going to decrease in alveolar ventilations, which basically means if this is, look, if a lot of fluid is accumulated here, what's going to happen is that can you participate in gas exchange? No, because remember, whenever the fluid is accumulated here, what is going to happen is that the diffusion, if you remember, the diffusion is what? Diffusion is equal to, because the fluid, what happens? You're creating sort of like thickness, and what happens is usually for the gas exchange to happen, you need to have like increased surface area, and you need to have a very thin surface area, so that way it can have a possible gas exchange. But here you have a decrease in tidal volume, that means you have decrease in alveolar ventilation, means they're not participating in gas exchange. Plus, what you have, because of what happens, you have increase in what? Workup breathing, which means like every time you try to breathe, you have to forcefully breathe, okay? And that can give you what? Dyspnea. That's also another thing you get to see, right, with these people, dyspnea, right? Meaning dyspnea, and then you see the positive, this interstitial pressure, right, because of this, and because of what happens is that you're going to have a decrease in obviously lung volume, because lung is started getting collapsing now. That is what is happening here, right? Now, if the fluids keep accumulating, then what's going to happen is that, what happens is that, look, they're side cells, right? These guys are, obviously, this fluid is going to start going to the alveolar, okay? And remember, one more thing I do have to say, whenever fluid is accumulating here, there's some of the receptors here, okay? They're called juxta capillary or pulmonary C-cell receptors, okay? What happens, they get irritated, they get stimulated, okay? And when they get stimulated, they have a vagal stimulations, okay, onto down here and bring it to this what? On your respiratory center. Okay, and whenever this bring it with the vagus, the afferent fibers will bring to the respiratory center, and what happens is that can cause what? That can cause apnea, which basically means, okay, which means you're going to have what? Increase in respiratory rate. That's going to cause that, okay? Apnea, which means that's what apnea means, right? So you're going to have an increased respiratory rate, okay? Your shallow breathing, that's what it can cause. Other thing it can do is that, okay, a couple of things. Now, the fluid can what? Accumulate here. The fluid, if it's like severe, if it's prolonged, what's going to happen? Fluid is going to start leaking out to this what? To the alveolar cells, okay? Alveolar cells, and also not only that, what happens is that a lot of times, if this keep going, what happens is that the neutrophils or pus and a lot of fluid are going to get accumulated here. Now what happens is that means because the cells are infected, the type 2, that means they're not producing surfactant first of all, and surfactants, it makes this alveoli dry, and now it's not able to do. And then also these neutrophils, what happens is that the neutrophils have very high, they're we call this they're called micropolicemen of the blood. And what they do is they have like, what do they do? These guys have those very like, what is this called? HOCl. Myeloperoxidase, they have this. So they're very reactive oxidase species, right? So what happens is that they can start releasing this, and because of that, what happens is that they're going to start damaging all the cells down here, okay? And because of that, all this fluid started leaking out. You're going to have a lot of pus build up. Neutrophils is going to be there. A lot of fluid is going to be there. And what is going to happen is that they're going to be like macrophages and all that stuff, right? Neutrophils, macrophages, a lot of fluid. And what do we call that? And that is inside the alveoli. What do we call that? Okay. That's called consolidations, or simply that's called pneumonia, okay? And people who have coronavirus, they do have a pneumonia too, right? So now these people even have a pneumonia now. And if some alveoli, what happens is that some of the fluid, it leaked out and it went out to the what? Into the bronchi, okay? If it went to the bronchi, what is going to happen? They can irritate the bronchi, right? When you irritate the bronchi, what's going to get? Okay, some of the fluid is going to leak out and start in the bronchial wall. What is going to happen? Then you are going to get a cough. What kind of cough? Dry cough. And people who have coronaviruses, they do get a dry cough too, right? What else? Okay, sorry about that. If the fluid is so much, then what happens is that it can cause the bronchial vein to get engorged, get bigger, and then what happens is the bronchial vein can get engorged and then get ruptured. And if that happens, what can you see on the patient? Whenever they cough, what do you see? You see blood. So hemoptysis can occur too because of that. Okay, so blood, coughing blood is called hemoptysis. Let's just write down coughing blood. This is what is also happening with the people with the coronavirus disease, right? Now we see this. See now. With the pneumonia, let's just quickly look at pneumonia. Pneumonia is dangerous, right? So what happens is with all this pulse and building on pneumonia is here, what happens? And if you auscultate, what kind of sound you will see with the pneumonia people? Pneumonia people, you will see those, what do you call? The fine crackling sound, right? If you auscultate. Crepitus, that's what we call them, right? That's what you get to see. And then every time when you take, like, let's say, when you try to take the inspirations, what is going to happen is that when you take the inspiration, when you try to forcefully try to take the air in, what happens whenever the alveoli try to open and close, what happens is that they produces sound, okay? That is what crepitus means, a fine crackling sound, okay? The crepitus, you see crackling sounds also, right? For these guys, okay, there's a dry cough, dyspnea, fever. We talk about like coughing blood. You could see there is a decrease in compliancity, decrease in total volume, decrease in alveolar ventilation, but that's definitely going to be increased respiratory rate, increase of work or breathing too, right? Out of all that things, Now, all this is happening, right? What else is happening? Whenever these guys are not, look, all this fluid is built up in all this, can they participate gas exchange? No. If they cannot participate gas, what is going to happen? That means what is going to happen is that your oxygen level is going to do what? Is going to drop. Your partial pressure oxygen is going to go down, right? And if the partial pressure oxygen goes down, what's going to happen? Maybe, okay, well, the partial pressure oxygen goes down, but sometimes what happens is that carbon dioxide doesn't go down, right? It's probably going to go up. And then this carbon dioxide, what happens is that they can go to the nervous system again. Like right here, if you bring it down nervous system, and what happens is that they go to nervous system because carbon dioxide is highly lipid soluble. It can what? It can get bound with the carbon dioxide with what? CO2. It can get with the water after crossing the blood-brain barrier, makes what? Bicarbonic acid. H2CO3, and then it goes into H+, and then you bicarb, right? And this H+ what can stimulate the central chemoreceptors, and that central chemoreceptors are going to do what? Can stimulate your respiratory center. So that means what do? You try to you try to ventilate, right? So it's called hyperventilations. In that case, what happens is that you may able to wash out the carbon dioxide. So carbon dioxide level may, because maybe pneumonia is here, but maybe not in here, right? Maybe the carbon dioxide will probably able to go out from this way, okay? That could happen, okay? But what about the oxygen though? That's the problem here right now. Maybe you're able to throw the carbon dioxide, but not the oxygen. And whenever you have a low partial pressure oxygens, okay, a couple of things happens. One of the things is that, okay, if you remember this, guys, like on your, let's just quickly make it. This is, if I make my heart right here, okay, let's just make this aortic bodies, right? If you remember this aorta, and aorta has this, left common carotid arteries, all that kind of brachiocephalic trunk too. Let's make this one common carotid artery, left common carotid artery, which splits into two, which is your left internal and left external carotid body, right? Artery. Left internal, let's make this as left internal. This is a left external. And if you remember, there is this in between, there's something called carotid bodies. And here there is also something called aortic bodies, right? And aortic bodies and carotid are very, very sensitive to what? The low partial pressure oxygen, right? And then what happens is that they have these cells called glomus cells, if you remember. Okay, and what these guys do is like they're very, very sensitive to the low partial pressure oxygens. And what happened is that whenever they sense this, there's a partial oxygen. What happened with the afferent fibers? Okay, with the glossopharyngeal nerves, and from this one, it'll bring to the respiratory centers, right? And then what happens? They'll try to increase the ventilations, okay? Because you want to try to more air in too, right? Now, with all these things, basically what is happening is that what? you're having a problem with the respirations, right? You're gonna have you're having a respiratory insult, okay, right? That's what you're having. Now, because these people having difficulty breathing, okay? So this is called respiratory arrest. That's what's happening with them, right? And then this low partial pressure of oxygen right here, okay, that can result into what? In hypoxia too, because remember, this is now has to go to what? This has to go to the heart, okay, and the heart has to pump, okay? Heart has to pump heart has to pump and actually provide enough oxygen nutrients to the tissue, right? Now, if let's make this as my heart right here, and let's make this a systemic circulation, so if I make has to do, and this is my systemic circulation right here, and if these tissues are not receiving the oxygen, what happens? The tissues are start producing a lot of this metabolites, right? You're going to have an increased level of lactate is going to go up. You're going to have a lactate, all these protons, concentrations are going to go up too, and what happens? They're going to cause these vasodilations of this. That's what these guys are going to do, right? They're going to cause the increase of lactate, increase this kind of vasodilations. And remember, what is my blood pressure is equal to? If you remember, my blood pressure is equal to what? Is equal to my cardiac output times my total peripheral resistance, or systemic vascular resistance, let's just make that. And then with the vasodilatation, what happens? Your systemic vascular resistance is going completely down. Plus, what happens, remember the fluid are leaking out here. That means what's going to happen? Am I going to get enough blood volume in my heart? Probably not. There'll be decrease in preload. That's also going to happen. Okay, that's going to happen. Decrease in preload. And other thing is that this interleukin, if it products in a greater amount, what this interleukins can do is that, remember, they can do vasodilations too, and they can stimulate the nitric oxide release too, and you can have entire systemic circulations that can get vasodilations. Okay, whenever there are vasodilations going to happen, what is going to happen is that there will be all these guys are going to be, there will be a decrease, and what happens, you have a complete decrease in blood pressures, and patient can go something called septic shock, right? And what also happens is this interleukin, they can go to heart. Okay, let's just make this as heart. And what happens is that these interleukins can actually suppress the contractibility of the heart too. That's what they can do. Okay, in that case, what is going to happen? If they suppress the contractility of the heart, means they're not going to have, that's going to cause a cardiac injury. Okay, number one, that's going to happen. Other things is that, okay, couple of things, that's what's going to happen, right? And if I'm just talking about our heart here, if I make this, look, if they have this, heart has what? This, down here on the right atrium, they have this acidotic cells, right? And usually what happens is, okay, let's just make it down here. Okay, we'll just quickly talk about this one too. Okay, this is my brain right here. Okay, and then you have, okay, and then we'll just make this as my heart right here, okay? And heart has what? This SA node is right here, right? SA nodes have the autonomic nervous system supply, right? And what it does is that it supplies from what? It has the, let's make this as what? This is going to be my vagus nerve, okay? The vagus nerve comes, and with the receptors here, there are vagus nerve receptor there, okay? And what that releases, they always release acetylcholine, right? And what acetylcholine does at the SA nodal cells, it hyperpolarizes the cell, right? Which means it makes the cell less excitable, which means that it decreases your what? Your heart rate, right? And then, yeah, well, let's make this a sympathetic nervous system, and obviously that's coming from what? It's coming from cardiac accelerator center on the medulla, okay? And then this vagus nerve right here, and then let's make this as from here, cardiac inhibitory center, cardiac inhibitory center, and cardiac accelerator is releasing epinephrine, or norepinephrine here, right? And then, look, the concept here is that whenever, let's just make this as a long right here, okay? Every time when you try to take the inspirations, okay, what happens is that when you take in how the respiratory system works, when you try to take the inspiration, what happens is that during the inspiration time, what happens is that this vagus nerve, which releases acetylcholine, that is get inhibited. Okay, and with this vagus nerve that is working on this SA node to decrease the heart rate, if this is inhibited, what happens? If this vagus nerve is inhibited on the SA node, that will increase your heart rate, correct? And then during the expirations, what happens, let's make this during expirations, what happens is that they will stimulate this vagus nerve right here, okay, and then that will decrease the heart rate during the, and these are physiological changes that happens, right? Remember, here what is happening, because of this, we are trying to forcefully take the air in, right? We're trying to take the forcefully air in because, remember, because of our, this has become edematous, right? Because we already have low partial pressure oxygen, we have hypoxemia. So because of what happens is that you have to take forcefully, you have to treat, and we have already dyspnea, means respiratory arrest is already happening there. We have to forcefully take the air in. So whenever we try to increase, so we try inspirations, right? When we try to forcefully try to take the air in, what happens? Now we inhibit this vagus nerve so strongly that our heart rate goes so up. Okay? That can cause tachypnea or tachycardia, right? Or simply we can say that that is called arrhythmia. Okay? The arrhythmia can also see in the coronaviruses. Okay? Now, that's the other thing, right? What else is going to happen now? Now, thing is that now with this, coming back to this, okay, now there's the cardiac, there's a decrease in cardiac output, the cerebrovascular, the septic shock is there. Okay, what else is going to be? It is going to affect other organs too. Like if it's a high level of organs, if you want to be very, very clear, okay, what happens is that, these interleukins have receptors on our important organ, which is liver. It can go to liver, okay? And what happens when you go to liver, the interleukins can release a lot of this, something called C-reactive, these proteins, okay, and these are complementary proteins that they'll release. So they'll get to release this. They'll also probably release like those AST and ALT sort of things. You might have a bilirubin that's going to go up too. You're going to see that too, okay. And then obviously there's an increase of lactate and all. And not only that, like what happens? There is these are leading to a systemic failure, right? Not only that, it can go to the kidney, okay? And what happens is that it can also, because interleukins have a receptors on kidney too, okay? And this is gonna like damage your kidney too, actually, okay? So that you're gonna have the acute kidney failures too. This could lead into acute kidney failures too, okay? And then also, not only that, but there are also like some other stuff that you probably get to see with this. With this is going to be, let's just quickly talk about this. What else are you going to see? So you have all these bilirubins and all that kind of stuff, right? Multi-organ failures, and especially for the kidney, you're going to see like high level of creatinine going up. You're going to have a increased level of BUN, which is also going up. That's why you get to see that one too. Even in the bilirubin, you get to see. And then obviously, if you're talking about the septic shock, you're going to see for that one, for especially for your heart, you're going to see something called the D dimers. That's going to go up too. Okay, for the sort of cardiac injuries, and you're going to see obviously. Long prothrombin time. What does that mean? Because remember, this one, when the vascular cells of these endothelial are, what happens is that this is got damaged right now, right? And they're going to start, the blood is going to get coagulated too. That's also started happening here too. The coagulation is also going to take place, and clotting things could happen too. So you're going to see whole, you could see like prolonged prothrombin time or thromboplastin time too. You get to see that kind of stuff too. Now, these guys, now what else is going to happen? Now, whenever these guys are coming here, right, the interstitial edema, like the fluid are building up in here, then really what happens is that, okay, whenever there's a low oxygen is low, right, this low level of oxygens can do a lot of damages, right, because remember, your tissues need oxygen in order to work, and if they don't get any oxygens, then obviously that's going to create a problems for them, right? So there's less saturations, and the less saturations, so they're not going to participate in the ventilations and perfusion. There is going to be a low ventilation perfusion ratio too, right? That's what you get to see. There's going to be a mismatch of the ventilation perfusion. It depends on severity, obviously, right? And then obviously, because of what happens is that this is all leading to causing the acute respiratory distress. Okay, that's what is happening with a lot of people who have this coronaviruses, right? They are leading into the multiple organ failures, okay? And remember, the most common one we are seeing the fever, dyspnea. And remember, these people also get a lot of fatigue, because remember, when the fluids build up in here, what happens is that, now whenever they try to contract, they will try to take the air in. What happens? They try to forcefully take the air in, right? So they're because usually breathing is it's not a conscious you're not aware of your breathing, right? But when you try to take the air in, sort of like what happens, you don't have the compliancy because of the paucity of this pressure down here. So because of what happens, that you're try to like sort of like forcefully try to take the air in, and because of what happens is that you get fatigued, you get tired. Okay, that is also you get to see with the people with the coronaviruses right now. Okay, there's a fever, there's a dyspnea. We talked about the product of this dry cough. We also talked about pneumonia. And that could kill the patient too. Then we talk about low increased work of breathing. We also talk about apnea. That could we talked about hypertension, how you could have a decrease in cardiac output, and then you have a like severe this system vacuum resistance can go down. Okay, and then later that can create a like septic shock with low cardiac output, and also there's a low vascular resistance. We also talk about how the interleukin can actually cause the problem, the contractibility. And then obviously we talk about all the roles of the pro-inflammatory, okay? Now, and then we also talk about a little bit about this chemoattractants and all the chemokines. And remember, like, you know, the most importantly is like I think they're working on the drugs on the interleukin-6. They're working on that one. This plays a very, very important role into this. Okay. Now, before even we talk about a couple of things, let me mention some of the stuff here too, which is going to be like some of the drugs. Actually, let me quickly mention about these drugs. And that is, maybe like actually we'll talk about in some other times about the drugs, but quickly, if I have to, and these are just like a general like a pathophysiology, okay, that I'm leading into, that this could give like a lot of problems, you know, and the most important thing is that in order to avoid this, in order to go all that kind of stuff, it's really important that we take a lot of precautions into this, okay? And I think there are like drugs that have been working into it, like especially for like, you know, they're trying to find the receptor blocker for this one.